Hello, everyone, and welcome. We are thrilled, so thrilled to have you join us for this webinar organized by Financing Alliance for Health, titled Strategic Investments in Primary Healthcare for Climate Resilient Health Systems. Thank you so much for taking out your time to join us this afternoon. My name is Maya Hayakawa, and I am the Communications and Branding Specialist at the Financing Alliance for Health, and I shall be moderating this super exciting session for today. Before I go on, I just want to make sure that everyone can actually hear me and that you can see me. So if you can chat, if you can just type in the chat box on there, let me know that everything is technically sound and that you can hear me. Before we start, welcome, Wendy. I see Wendy is on the call. All right, so before we dive into today's session, where we're really looking to explore some of the intricate details of this discussion, I'd like us to first take a few minutes to sort of go through some really compelling statistics that can sort of help us set the pace and the background in understanding the intersection between these two major fields, that is climate and health. So I'd just like to request our tech to put up the presentation so I can take you through a few of those statistics. And really, this is the reason why we decided as Financing Alliance for Health that this is an important topic of discussion and something that we should really think about. So first of all, when it comes to climate change, we do know that right now, 3.6 billion people across the globe live in areas highly susceptible to climate change. That is close, that's actually over half really the world and globe's population that are living in areas that are under threat when it comes to climate change. If you can move to the next slide, please. And this is according to the World Health Organization, that by 2050, climate change could cause 250,000 additional deaths annually due to malnutrition, due to malaria, diarrhea, heat stress, and other illnesses that are related to climate health. And this is, of course, in addition to all of the other health issues that we're facing across the globe. Another important fact to note is that it's projected to cost the globe approximately $4 billion US annually as a result of direct damage costs to health. And this includes costs in health determining factors such as agriculture, water, and sanitation per year by 2030. This is on an annual basis when it comes to direct financial costs related to climate change and health. And despite the fact that we have a huge direct impact on health and finance, yet less than 2% of multilateral climate financing goes to health projects. We've seen a lot of call to actions being made in terms of increasing investments into mitigating the effects of climate change. But when we look at how funding flows into health, it's just less than 2%. So this is an area that we're growing keen interest in, and a lot of funders are also beginning to look at how they can increase the flow of funding into health programs and just mitigations when it comes in regards to climate health. And if we look at the African continent, since we are here in Africa and we're also looking at specifically how we can increase investments in building climate resilient health systems within Africa, we know that 20% of the continent's population right now are suffering from food insecurity and malnutrition due to climate related factors. Remember that the continent already faced the continent faces quite a number of challenges when it comes to food insecurity, but climate change has actually exacerbated these effects. And currently 1.6 million people are affected in East Africa alone by the recent floods, with over 600,000 people displaced. 127 million people in Southern Africa face hunger due to poor harvest, mainly because of the droughts that are being faced across this region. We know that some regions like the Zambia have actually declared drought as a natural disaster and following 14 extreme droughts in the past 2 decades. Climate change is a growing threat to health with, again, 4 billion projected yearly cost per year by 2030. So urgent action is needed to mitigate these impacts. And when it comes to the human toll, 64 natural disasters in Africa in 2023 alone, with a death toll of 20,000 people as a result of climate change in 2023 alone. Now, what we're saying as a Financing Alliance for Health is that community health workers are the unsung heroes when it comes to mitigating the effects of climate change and playing a crucial role in climate change preparedness and mitigation and adaptation at the community level. Yet there is a funding gap. We need about 4.4 billion US dollars annually to bridge this gap and to really support the work that community health workers do. So we're saying that we need to act now. There is no time. We need to act now to build resilient health systems. And that's why we're having this webinar. All right, so at the heart of all this, our community health workers and volunteers, they are the backbone really of primary healthcare and overall health systems. They help us connect our communities with health systems, and they have been at the front line. We have seen during the COVID-19 pandemic, we've seen them also playing a great role in epidemics like Ebola across Sub-Saharan Africa, and they need to be well supported and well resourced. So we, as the Financing Alliance for Health, are bridging the gap. We are working with governments. We're also working towards building initiatives to mobilize resources for primary healthcare at the community level. And the goal of this session is to invite all the experts, the various experts, the various different stakeholders that we work with who have come here today to enrich the audience today, to come together and share the solutions and insights on how we can actually begin to think about how we can create climate resilient health systems through investments in our community health workers. So for all of you that are joining us here today, I would really love to know where you're all joining us from. Please type in the chat box and let us know your location. Tell us where you're from. And this can really help us understand where you are joining us from, but also understand why you wanted to join us and what you do, what it is that you do, whatever sector you're from, whether you're from the government, you're from NGO, if you're a community health workers. We're really interested in knowing who you are and where you are from. So I'll just give a few seconds for you to just chat on the chat box. Let us know where you're from. Let's see. I'll start with myself. I am joining from Nairobi, Kenya. Wendy here says that she's joining from Kenya. I have here someone joining us from Philippines. Welcome. We have someone from Brazil who's founded an NGO, if I get this straight, to promote health access. Wonderful to hear from you. We have Shivani joining from London, Nelson as well joining us from Kenya. I've seen quite a couple of you joining us from the UK. We have some joining from South Africa. Cameroon is also in the building. There is Nigeria, Zimbabwe as well. I see Uganda is on the call. We have Canada as well. So we have such a great mix from different stakeholders as well. Awesome. Thank you guys for letting us know where you're from. So without further ado, I'd like us now to introduce our panelists. And I'd like you to all feel free to just, pop in your questions. If you have any questions, if there's something you'd like the panelists to expound on, just note it there in the Q&A chat box, and we'll definitely take note of that. So we're really excited and privileged to have our four panelists with us to share their experiences and their insights. And we try to have, a really diverse set of panelists to be able to enrich this conversation. So we have Dr. Joanna Sanchez from Grand Challenges Canada. She's a senior program manager at climate change and health at Grand Challenges Canada, with over 15 years working experience in global health, environmental health, climate change, child nutrition, clinical research, and research management. Really privileged to have her on here. We also have joining us Mr. Nathaniel Soloku, the government representative from the Ministry of Health in Sierra Leone. He is a health economic analyst at the Ministry of Health of Sierra Leone, and he has a robust working experience of over 13 years in Sierra Leone. He has a strong background in developing programs and managing projects, in costing strategic and annual work plans, and has worked across different sectors in the Ministry of Health in Sierra Leone. We also have joining us this afternoon Ms. Dorothy Mwenge, who is our very own health technical advisor from the Financing of Health. She's worked with our Ministry of Health here in Kenya on strengthening health systems, enhancing access to quality health services. And she has had significant roles in her career, including field project manager for PwC, reproductive health, out-based aid approach vouch project across several counties in Kenya. We also have with us, very privileged to have Mr. John Wabwire, who is a quite popular, famous community health worker and climate activist here in Kenya. He has over 13 years of experience in working as a community health promoter and climate health champion, a strong commitment in improving public health and well-being through community focused initiatives. To this day, he's still working as a community health worker, and also just pushing this agenda for considering climate change when we're looking at community health workers. So a round of applause, or a virtual applause, for our panelists who are joining us here today. And today's session, we're looking to achieve these goals. We're looking at examining how climate change has had a devastating impact on health outcomes in Sub-Saharan Africa. We also just want to highlight the crucial role that community health workers play in enhancing community resilience to climate change through healthcare services. We also would like to discuss current resource deficiencies, and also look at what the funding gaps are in the health systems, and look at some of the solutions to that. And also just looking at funding approaches, and maybe perhaps also highlighting some of the case studies that our panelists have worked across, the different countries. All right, so without further ado, let's dive straight into the topic. I'd like to first of all just start off with just painting the general picture to understand how climate change is impacting health outcomes in Sub-Saharan Africa, and what this really means for us as a continent. And I'd like us to start with you, John, because you are on the ground. What have you been seeing on the ground when it comes to how climate change has been impacting health outcomes?
Okay, hello, thank you very much. I hope you hear me.
Yes, we can hear you loud and clear.
Climate change significantly impacts health outcomes in Sub-Saharan Africa. It's an existing health challenges that are creating new things and new environments. Here's the rising temperatures, changing participation patterns, and the decreasing frequency of extreme weather events. This is like things in lead to disruption of food security, and it's leading to malnutrition and micronutrition deficiency in the communities where we work as community health volunteers. This climate change also increases the spread of diseases. These are vector like mosquitoes and some other like vector-borne diseases and waterborne diseases, amplifying like things like malaria, fever, and those other vector-borne diseases that can come with the all those climate, like the flooding, when you have the floods, when you have the much more on drought. It's also altered the distribution and prevalence of diseases like cholera, typhoid, fever and waterborne illnesses. These are also affect our communities when we have climate change. When you have more floods that comes around in like where I live, we have flooding every year, and this always brings a lot of problem to the communities. The climate change also enhances the risk and the heat stress. As we walk around the villages in households, we found that there's heat stress. We have heat waves and other heat-related diseases that leads some of us to be very weak and also dehydrated. And this is so much affecting uh, our our daily duties as community health volunteers. This one also lead to an increase on the mental health burden due to displacement and also the trauma and social unrest to also young people who are also now doing suicidal. They make commit suicide because of this mental health burden, which is due very much more here in Africa and also in Kenya. We have the future trends that is continuing to work on this. These are the continued temperature increase. Like now we have a very hot weather that's increasing more frequently and extreme weather events that are so much more in temperature increase in areas. We have the shift in diseases distribution and the emergence of new diseases. We get new diseases that cannot control as a community health workers. So where we work as in households. So this can also help us. The climate change is affecting us in this way. We have also increased the water scarcity, and also sometimes the water scarcity is increased due to drought at times, and also flooding when it comes a lot of water that comes from climate changes that have the effect from climate change. We have the competition for resources that everybody's competing for something to work on because some things are now diverted and they are not there. So you find that it's very much impossible to get some resources during this time as the climate change is bringing havoc in this area. And the growing amount of health causes is due related to climate stresses that comes with these things. For this, we need to do much investing in community health workers for climate resilience health systems. This will help us to crucial building climate resilience health system that will help us to provide essential health care services to remote and also hard to reach communities in our regions and also in Africa as a whole. We can also adapt quickly to emerging health needs during climate-related crisis. I hope this one can be what I have for now, and somebody can add more as we continue. As can be part
So,
of this climate. Yes.
absolutely. So you've highlighted the impact that climate change has had on health and what this means for community health workers. I'd like now to cross over and hear from you, Nathaniel, because you work directly in government, and we've entrusted the government really to look at our health systems and to ensure that our health systems are adaptive and are resilient enough to deal with these emerging issues. So I'm curious to find out from you. What you are currently doing right now, the strategies that you're implementing as government right now to address some of the health consequences of climate change.
Can you hear me, please? Can you hear me?
Yes, I can hear you. How are you, Nathaniel? Looking good.
I'm good. Maya. Thank you very much for calling me. And I just want to inform everybody that from the government side, we are putting a lot of strategies in place to make sure that we have a resilient health system as far as climate change is concerned. I will start from my country perspective. We all know that climate change has a lot of adverse effects as far as the health system is concerned, especially around our peripheral health units. So the peripheral health units are the lowest level of care. And because they are the lowest level of care, most of them are actually based or situated in areas where we have a lot of challenges as far as climate is concerned. So currently, as a country, I want to inform you from the government side that in 2007, we, as a country, we developed what we refer to as the NAP, the National Adaptation Plan for Climate Change. So the NAP was then now revised in 2021. So currently, Sierra Leone has what we refer to as the National Adaptation Plan for Climate Change. So this plan is actually to have an intersectoral integration of all those sectors coming together to see how we can work towards improving a resilient health system, not only the health system, but all other sectors national plan was led by one of the agencies usually referred to as the National Emergency Protection Agency, that's the EPA. The EPA was actually leading this particular process. So in 2023, also our minister and a delegation from the Ministry of Health and also other MDs, ministry departments and agencies attended what the COP28 in the United Arab Emirates, that is in Dubai. So when our minister came back with the delegates, and they had a very important meeting with all development partners in the country. And now I want to inform the House that Sierra Leone has the first ever, what we refer to as the Health Unit for Climate Change. So the Health Unit for Climate Change was launched on the 4th of April 2024, this year, meaning that there is a very good, a robust step by our present minister, Dr. Dendi. We are moving towards having a resilient health system, and therefore now we have a support from the World Bank. The World Bank is supporting that unit to ensure that we have a climate, the health climate unit within the Ministry of Health in Sierra Leone. And also another key strategy that as government we are using is to have intersectoral collaboration and to ensure that we have domestic financing for climate resilient health systems. So most times what happens is that because the government and other partners are actually focusing on the direct health services that are needed by the people as it is now, but we all know that climate resilient health system fits into the future. That tells you that it's an investment that you do for the future or foreseeing things that you expect them to happen. So those unforeseen investments before this time, government have not been giving too much priorities to them, and also it has been donor driven. So one of the key strategies that we are now moving towards is that to have more funding from the side of the government to ensure that we have support domestically to support climate resilient health systems. We also know that the government has put a lot of strategies in place because we know the relationship between climate change and the burden of diseases. So in 2 years, government has been supporting through the malaria control program, supported by Global Fund. We have been also undertaking what we refer to as the vector control program. So the vector control program was actually done in selected endemic areas where we have high burden of malaria diseases coming from the country. So the vector control program under the malaria control program, the vector control unit was responsible to implement the vector program in 6 districts across Sierra Leone. So they did what we refer to as the indoor residual spray. So the indoor residual spray was actually done in all households across the districts that have been identified as high burden areas for malaria in Sierra Leone. So I think what our minister is moving towards now is to ensure that we have intersectoral collaboration and also improve on domestic financing for a resilient health system for climate change.
Nathaniel, I'm hearing from some of our participants here that you're not very audible. So if you can take some time to just fix your mic a little bit, just to make sure that we can hear you. Yeah, but from what I'm hearing from you is that there's a lot of push to push for domestic resources, domestic financing, and that this is really something we are building as we go along, and learning really as we go along. So this then brings the question into the role that non-state actors are playing in mobilizing these resources for community health. And that's where Dr. Joanna Sanchez will jump in. I'm keen to hear your perspective on this, Joanna, in what are the conversations among funders like right now? What are the conversations like when it comes to addressing health impacts of climate change in Sub-Saharan Africa? Is this something you're seeing funders take more interest in? And yeah, I just want to hear from you in terms of where the conversations are at right now.
So the conversation is very much active right now. This has really been helped by the prioritization of health as an important and critical impact of climate change at COP28. And then just a couple months ago at the World Health Assembly in Geneva, where it was also listed as a priority outcome and a key focus. And so this helps us as funders sort of not redirect our attention, but add it as a key strategic point in all our funding. And I will tell you that, you know, I'm in conversations with funders from around the world. I recently came into the role at Grand Challenges because it was determined to be a priority at Grand Challenges Canada for our next 5 years strategic plan. And so we are seeing that funders around the world are quickly gathering groups. They are creating teams. They are writing it into their future programs. And so there is a lot of activity quickly moving and a lot of stuff coming down the pipeline. Where we're trying to sort of organize is how to sort of collaborate on these efforts, because data is emerging quickly, not always in the most organized fashion. I think that's one of the gaps we have, that especially in Sub-Saharan Africa, where we need more data. We need more locally driven data as well to see where are the priorities, you know, where should we direct the money, where it would be most impactful. But we are seeing a lot of collaboration and conversations happening between funders, which is exciting because we know that it's going to become a quickly very active and busy space. And so we want to make sure we're not all, you know, focusing on the same things, that we can spread the activities and hopefully have the most impact. And at the same time, I think what's exciting also is that we are all seem to be consistent in that it's a priority for us as a very specific focused activity within where we're going to direct our funding, but also in all of our global health thinking in general. Like climate change is going to impact all our programs. So I think climate change is going to just sweep across the boards in the same way a lot of us have been thinking about gender, for example. Now we're all going to be thinking about climate in everything that we design and do. And so another thing I'm seeing that's very important and exciting with the funder is that everyone has a deep desire to really make this locally driven, really work with the people most impacted by climate change, and that hopefully the priorities be guided by the locals. And so we are engaging in different ways to determine that. Grand Challenges Canada is going to be launching some key important landscape analyses, and hopefully we'll be releasing our own funding next in 2025. But a lot of the funders are doing the same thing. And one of the key things I think to know is that we are all talking to each other. We are very much speaking to each other and setting up collaborations, hopefully, and pooled funding as well to see. And we are all agreed that this is urgent, that money needs to move fast as well. So those are some key and important activities happening on our end. And I can get into more specifics as well as questions arise.
Could you just expound a bit more on the data aspect? What specific data do you think would be helpful for you as funders to prioritize where the dollars and where the money should go?
Sure. So for example, we know that the health systems need to be resilient, need to prepare, but how? You know, the health system is huge. So do we need more education? Do we need more staff? Do we need both? But where's the priority? It's almost like we need a sort of priority list of the sort of things, the gaps, the barriers that are, and this is just an example. So if we're looking at community health workers, how do community health workers feel that they would be most supported in order to face the climate change challenges? Is it that they just don't have the capacity because there aren't enough of them, or they just are seeing diseases that we weren't seeing before, for example, and they're just not adequately trained on how to address that, and then the health systems aren't unable to receive them, and also just to see where the biggest impacts are. So we know about droughts, we know about food insecurity. But this is where that locally driven approach would be helpful. Like, what are the key challenges? Each region, each geography is going to have its own challenges depending on how they're being impacted, and sort of having that information in terms of, you know, for example, Kenya, what is Kenya's biggest struggle, biggest challenge, biggest barrier? Because it might be a tailored geographic approach, you know, west versus central versus east versus southern part of the continent. And we're seeing that across the world, where we might need to take a very tailored geographic approach because everyone's seeing sort of different epidemiologists. And I will say that I'm an epidemiologist by training as an academic. And so really the data should sort of guide our efforts and hopefully also contribute to generating more data as we finance activities. So it would be very helpful for us to know, like, and if we're looking from ground level community health workers, where is the primary challenge?
Speaking of challenges, so Dorothy, I'd really love to hear from you. If you could highlight for us what you think those barriers, what those gaps are when it comes to policy making. From that local perspective, what are you seeing right now? Other gaps?
Okay, sorry. Okay, thank you, Maya, and welcome to the fellow panelists and participants. I think as a continent, or as Sub-Saharan Africa, we are not short of good policies. However, the policies that do exist they lack some aspect of public participation. And if public participation is even well aligned, how well are they human-centered to fit the needs of the societies that we are envisaging to serve? And I would like to look at climate using a very broad lens, and even looking at, I was reflecting and thinking about our cultural values. According to my society, we had shrines where we used to conserve environment, and those forests could not be interfered with. And I think engaging the communities to develop policies that are aligning to the cultural and social norms that exist in the societies would be one good thing. Then two, I think I was looking at the Libreville declaration that was done by the ministers of environment and climate in 2008. And I was thinking, if we are thinking about climate change and health, or climate and health, I think we are supposed to think broader, because it's like affecting every department. If you look at the climate disaster that we had in April in Kenya, if you look at it, was cutting across gender, agriculture, our roads were distracted, children could not go to school. I think we are going to look at, gaps in terms of looking at it using a very broad spectrum. Think in terms of capacity, as Joanna said, I think people lack capacity. If you look at our systems, climate is not integrated to other systems. It's only people who are in the climate space who understand what is happening in the climate sector. So I think if we can integrate it in the other sectors, or being part of the curriculum for people to learn about climate change and what are the requirements. And I'd like to look at health, because it's like we are, people think health is like they are only recipients, or they are only vulnerable to climate change. They also contribute significantly, like 4% globally, to the greenhouse gas emissions in the system. So I mean, even in our health sector, as people get trained, not only in health sector, in all sectors, but in health, I think we need to capacity build people to understand what this climate change is, how to mitigate and adapt it to the climate crisis. And something else that I think is justice systems, because we have very good legislations, policies, laws that do exist, but they only apply very firm to the people who are disadvantaged. But for people who have money, because of lack of transparency and accountability, you find that if Dorothy goes to a forest and cuts some few trees, I'm likely to be punished more than person who has money and has deforested like the half of the forest. I think also transparency in our systems. And if you look at the SDGs, you find that I was looking at the report for the SDGs in 2030. It shows that if we continue the way we are continuing, it will take us 286 years to close the gap in the legal protection and remove the discriminatory laws. So I think we're also supposed to look at our justice systems and to support in terms of reinforcing the regulations that we put in place, and they apply equally to everyone despite the social status. And I think another thing is developing countries. I think we have been on the bottom of the value chain. So I think shifting them to the discussion of where wealth is made, because I think degradation or this climate crisis we are facing, despite the developing countries contributing very significantly, like we are contributing only 4% of the green gas emissions. Yet we are the ones who are receiving the climate change is really affecting the developing countries more severely. So I think we should have a conversation as a globe. That is my take.
Okay, thank you, Dorothy, for that. I just want to take note that I can see your questions coming in. I've taken note of them from you, Nelson, and from you, Hasibul. I'll make sure to direct those questions to the panelists. But before I go into this question, because Joanna had brought out this important point, which is what is the exact support that community health workers or whoever it is that is on ground need for them to effectively mitigate the impacts of climate change. So I want to hear from you, John. What support, if you were to prioritize the top three priorities for you as a community health worker that you feel would help you in mitigating these effects, what are the top three areas of support that are needed right now? John?
Sorry. Maybe for us as community health workers and who are mostly on the ground, the support we need mostly, we lack training. We lack training on this issue of climate change. As much as we are mostly in the real place where climate happens, many communities are like myself receive limited training on climate change and its impact on health, making it challenging to address these issues effectively. We have limited resources. Our community often lacks basic healthcare facilities, making it difficult to respond to climate-related health issues when it happens. We need this funding so that it can help us also to be much train other community health volunteers and community health workers in climate-related challenges that we are facing, so that they can control and mitigate the climate change correctly and effectively. We have this building trust with the community being a crucial thing. However, climate-related disasters make it challenging to maintain a regular communication and also engagement with the other stakeholders and also community members that we work in communities in the area we work with. I think these are the most demanding things that we want as community health workers. These are training, resources, and also make sure they have the community engagement, because to understand how to handle these climate issues, we need much diverse training than what we have for now, because mostly we train on health issues but not climate-related issues. So we need to be integrated this training so that we have both these trainings at the community level as community health workers, so that we can mitigate these effects of climate change effectively. Thank you.
Thank you for that. Joanna, there's a question here from Nelson. I think this question is directed to you. Nelson says that I have a project idea on decarbonizing Kenyan healthcare that will lead to freeing up funds in the hospitals. What are my options for of accessing funding? So I guess this question really is not just for Nelson, but also for others who are seeking for funding in whatever, grand ideas that they have. What are their options right now?
At least from our perspective, any information about any open calls for funding would be on Grand Challenges Canada website, but we haven't launched our big call, which would be in 2025. A lot of the other big funders across the world are already launching. Some of them have open calls. Some of them have new calls, like Foundation S, for example, although a lot of their work is focusing in West Africa. But there are unfortunately not fully coordinated efforts yet, but we're hoping to get there. But at this point, it's very individual funder by funder basis as to exploring what everyone's calls are. We do have a few open calls, some of them related to climate change on our website that you can check. But unfortunately, I can't get into too many specifics about all the funders around the world. Those would be case by case.
All right. Dorothy, I'd like to direct this question to you. So this question says here, while burden of communicable diseases continues, burden of non-communicable diseases are increasing. Health effects of climate change on top of rising NCDs are creating triple burden of vulnerabilities to these countries. Now, unfortunately, compared to the global health funding for communicable diseases, funding for NCDs and climate and health is very, very inadequate. What do you think of the prospect of integrating climate health and NCDs in our advocacy efforts for mobilizing funding from both domestic and international sources?
Thank you, Maya. I think demographic transition of diseases is happening across the region. And one thing I would say, non-communicable diseases, to some extent, they are preventable. And that's why, as Financing Alliance for Health, we are really fronting community health workers to support us in preventing early diagnosis. We do appreciate the fact that we are supposed to do a lot of integration of climate to not only climate, but also to all other sectors. As Joanna has said, we need to integrate the way we do gender. Climate should cut across because it affects directly every sector. So as we advocate for non-communicable diseases, as they increase, just know we are doing badly, because we are also doing it's contributing to like 50% of the deaths across the globe, and majority of the burden is in the Sub-Saharan Africa. So let's think about prevention, because the resources will never be enough. Look at what we committed to during the Abuja Declaration. Abuja Declaration happened 20 years ago. Just very few countries have managed to achieve that financing commitment for health. Climate change is also accelerating and widening the gap in terms of financing. So as we talk about financing, let's not also look at more resources. It's also how efficiently we are going to use the resources that are available. And prevention has shown to have higher return on investment. For example, in Kenya, we know primary healthcare has a return on investment for 1 to 16. And I would give an example. I was born in Kenya, brought up in a village. When my father suffered diabetes, like 40 years ago, he was the only person who had diabetes. He could not trace another person to get information. In fact, he had to travel like 400 kilometers away to get information on diabetes. But currently, it's like every household has a diabetic person. So are we going to invest more on buying glucometers, strips, and BP machines for community health promoters, or we are going to invest more on talking about physical exercise, investing on early screening, people taking the right diet, and also averting the climate change, because we know it is directly affecting on the nutrition or the diet that we are consuming. So I think let's think about prevention, then now the other things would come later. More budget, but we still have challenges besides, and the lessons that we have learned from even the declarations that we have done before. Thank you.
Nathaniel, how can policy support be enhanced to build climate resilient health systems? And what does it really mean to create and build a climate resilient health system?
Yes, thank you very much, Maya. I think policies are very, very important in this discussion, because talking about policies, it goes a long way. Once you have the policy, it is now being driven by the stakeholders. So for Sierra Leone, we started off by developing a national adaptation plan. So this national adaptation plan was just developed by an agency under the environmental ministry. But what is important about the policy is about intersectoral collaboration. So once you have the intersectoral collaboration, like another speaker was saying, what really is very important about climate change is most of the issues around climate change is only familiar to those who are experts in climate change. So now if we have a policy that has an integration, having other sectors, having other MDs to come on board, it keeps us on the right track and gives us the political will. Because once you don't have the political will at the end of the day, you have the policies and you have all the plans, but once you don't have the political will, then the implementation becomes a problem. So once you have a policy that can be action-driven, so once we have this policy that is action-driven, then now we have the government will, domestic funding will increase, then implementation also becomes very, very key. Because once we have the policy, even starting from the community level, we have the involvement of our community health workers. The community health workers have been trained, but what have they been trained on? We only have 3 key intervention areas that the community health workers are actually focusing on. But now if we have a policy on climate change, we start engaging stakeholders right from community level. Engaging those stakeholders at community level bring a positive impact to the entire chain. So I think the issue of policy is a very key one. It's very important. And for us in Sierra Leone, currently what we are doing is we have already a climate change unit under the Directorate of Environmental Health, currently now working with the Emergency Protection Agency, that is the EPA. So the EPA will be working with this particular unit. But what is important here is how do we involve our food soldiers at community level? Involving the food soldiers, I mean our community health workers, because it starts from deforestation. If you remember back in Sierra Leone in 2017, we lost over 1,000 lives from a mudslide, a flood that occurred in Freetown. So it is very important for us to see how we can reduce deforestation. It's very important to see how we can reduce the habits of living. Country planning, city planning is also very important. How do you do city planning without a policy? So doing city planning is very important because people build houses in a very risky area, those areas who are disaster-prone areas. But if we have got very strong policies that are backed by political will to implement those policies, I think people should have got a lot of houses around those flood areas. So in 2017, we had a mudslide, which we lost over 1,000 people. And I think because we have not got those policies to be actually implemented. So the policies we actually serve as the driver to whatever we are going to succeed at the end of the day. So I think having a policy that is integrated, we should have an integrated policy. Once the policy is integrated and we have an inclusive policy that includes all those stakeholders at all levels, starting from the community up to the higher level at national level, it is very important so we can have a very good drive in getting our climate resilient health systems.
I think this is a follow-up, Dorothy, to your comments. From Hasibu, who's asking the question of whether we have a case study of any country that has actually successfully prevented NCDs, with 1/3 of the population that is already having NCDs, which is causing about 17 million deaths per year. Don't we need to focus on managing NCDs with increased medicines access, together with focusing on preventing new cases?
Exactly what you have said. We don't mean that we are not going to manage the people who already have the diseases. And I think as Financing Alliance for Health, we are intending just to do a case study to see how much it costs the health sector, especially on managing complicated cases of diabetes, hypertension, and other non-communicable diseases. We are not saying that we are not going to refer, because ideally community health workers are supposed to screen and refer for management at health facilities. But this is a negative indicator. We should not be celebrating as we get and screen more cases, because it's something that we can do to mitigate diabetes and hypertension. For example, personally, I know already have genetic predisposition to having diabetes in future. So what am I supposed to do to prevent myself? Exercise. I mean, check the right diet, eat healthy, plus the rest, and avoid alcohol and smoking. We mean we are supposed to prevent as much as possible. Just like if you look at accounting, not only communicable diseases, if you look at communicable diseases, Makwende County spends 6.9 million dollars. I mean, $6.9 million per year to manage diarrhea. We won't say we are going to eradicate diarrhea completely in a day, but we know it's preventable, and you have put some interventions in place to prevent the diarrhea, just the same as diabetes. And if we are to have diabetic patients and people suffering from non-communicable diseases, is it possible for us to use our community health workers platform to prevent them from getting the long-term complications, which are very expensive to manage? So what we mean is, we know that it is an upward trend, but what can we do to halt? Because that is what the globe has committed to halt the upward trend of non-communicable diseases. I'm not saying we eradicate or we ignore the patients who already have the disease. Yeah. Clarification.
But I guess this is Thank you, Dorothy, for that. And I guess this is a question to all the panelists, because we're talking about, solutions to mitigating climate change, and the intersection that this has with health. What are some of the locally driven, innovative solutions that you have come across that you think are scalable, and is are projects that we should really look into when we think about replicating such solutions across the continent? This is to all of you, anyone who would like to share anything you've come across.
I'll say a few things first. So climate and health is a new space we're entering, but we're already seeing a lot of interesting, potentially scalable solutions in digital health. So digital tools to support community health workers, such as like early warning systems. So, and we're seeing some of that actually come out of Kenya, and also have the opportunity to expand across the continent, and perhaps provide a tool for community health workers to know that there are potential challenges coming. If we're seeing potential weather challenges ahead and potential climate disasters or increasing temperatures, for example, in the next few weeks, then community healthcare workers could be prepared as to what those climate hazards could bring in terms of a health perspective. So they'll be aware, okay, we're going to have a lot of heat stress in the next few months. So, to be something for them to be prepared and forewarned about. But also, as we talk about NCDs, those are some of the most vulnerable people, especially when it comes to certain climate hazards, such as heat stress. People with diabetes are at a high risk of kidney failure and such when coming across climate hazards. So perhaps even knowing community health workers know their population, they know who they're working with, and they know perhaps who they need to target if they know what's coming. So we're seeing some pretty exciting AI and digital solutions, so using technology to empower the people on the ground, and perhaps a tool that could also be widespread and used across ministries of health also as they monitor the health of populations with changing climate, especially if we know something is coming and how it's going to impact, for example, pregnant women and newborns and all that. So there's some exciting solutions. What we're just trying to make sure is that they're not all very duplicating, which is the most innovative, which is the most impactful and has the biggest opportunity for scaling. And I will say for anybody out there with ideas, it's very important to have smart partnerships. So are you already engaged with government or policymakers when you're coming up with your innovation? So that will tell us, the funders, that, okay, they've already thought about how to make this broad, how to take this to scale. We want this to have an impact across tens of thousands, millions if possible. And sometimes the only way to do that is if you have buy-in from government level and policymaker support as well. So coming to funders with that sort of those relationships already in place, in addition to potentially groundbreaking innovation, I think is key.
Right. Yes, John, you're unmuted. Do you want to say something?
Oh yes, I was to say something. I hope you hear me. As part of the solution, I was thinking this way. We can also do invest in community health workers. This will lead to a climate resilient health systems. By investing in community health workers, this will be building climate resiliency, and also will increase the health systems, because community health workers and promoters provide the essential healthcare services to remote or hard to reach communities. This is where we go hand on this. We can also adapt quickly to emerging health needs during climate-related crisis, because we are in the ground, and this is where the climate change is happening mostly. We can offer cultural sensitive care, like essential for addressing diverse community needs. This can happen on the ground. This will also help mitigate the climate change when we are invested in. We can also serve as early warning systems, because we work in these rivers. We can know when these things will happen. We know when the floods will come, and we also experience these things all over. So it's essential for addressing diverse community needs in these places. We can also facilitate community-based initiative for disaster preparedness and response. This is by education. We must work. We work with these communities. We provide with education every day at the doorsteps daily. So when they come and talk about the climate change, I think this will help them to also know how they can mitigate climate, also by like the carbon footprints that they know how to dig, also how to harvest things, and also how to move and how to conserve the environment. This is very is very crucial for investing in community health workers. We can also be empowered in this to address climate-related health issues by receiving training on climate change and its impact on health. Because now this is key, because we must train these things I had said earlier into climate impact and also the health that we are working on. We must have having access to mobile health technologies and also communication tools that are also like Joanna said, the AI issue, where we can also integrate this in our health trainings and also working with this in the community level. This will help us much more. We also integrate climate sensitive intervention in our daily work. We have to make sure that if we invested in, we'll make sure that as we work together in our daily work, as we go to community, we are having these interventions on climate change, and also have to be participating in community-led initiatives for climate adaptation and resiliency. Maybe empower us, give us opportunities to attend all those climate-related workshops and seminars, and also all those who want to be participating in this climate issues. I think this will help us. Thank you.
Those are very practical suggestions. I just want to be mindful of time. We have 3 minutes left, but I'm seeing questions are coming in hot and fast. Kirigo here has asked this question. As we seek financial support, could we explore carbon projects in healthcare that can be floated as carbon credits to the carbon markets? I don't know who'd like to tackle that question, because carbon credits, we've seen that conversation has really taken off across the globe, and people are even trying to figure out now what exactly are carbon credits. I mean, so as a continent, do you think we're prepared and ready to be part of that conversation, Dorothy?
I think carbon trading would be a good avenue. I think sometimes back we had a conversation with one of subnational governments here in Kenya, where they wanted community health promoters to be benefiting from carbon credit, because it's one among the governments that are benefiting very large in terms of carbon trading. And I think it will be a good venture. And now that Kenya has even shaped it up and regulated, we already have regulations that were done in 2020. They were signed in May this year. So, I mean, it's something that we can try exploring, not only for community health workers, but in the entire healthcare space, to see how they are going to benefit from the carbon trading. I've seen organizations that are supporting, like Netflix and Gushi. They are really supporting for organizations that are doing, they're reimbursing for carbon credits. So I think it's something that, but people are not aware of it. So it needs a lot of awareness for people to understand how it is. There also needs to be a lot of transparency for people to understand what is entitled in that carbon trading. Because I think this information, as I've said, it really sits with the Department of Environment and Climate. Another thing that I would like to say, Maya, before I finish, it's we are more reactive than responsive. Reactive than responsive. We react, we mitigate, then the next year or the next disaster comes and finds us and messes up with us more than the way it found us. So I think we should generate evidence and forge way forward on how to mitigate climate change. And I would give a typical example of the semi-arid and arid counties here in Kenya, where we usually know during the dry season or drought, we are going to complement children to mitigate undernutrition and avert the ice stunting that we're experiencing. Every time. And the stunting keeps on increasing. Instead of sorting out the climate change issues, we are so much interested in treating the malnutrition and doing the complements without just putting a caveat to say we will not want to reach there. So what are we going to do? Keeping on learning lessons and generating evidence on what has worked and what has not worked. I think we need to be more responsive than reactive.
That's a really great point. Okay, Nisha, I'm hoping that some of your questions were answered from John, and just picking up from also what Dorothy had to say about looking at, not being so much reactive, but also just when it comes to disaster preparedness, being more prepared, and that goes into part of enhancing climate healthcare resistance. I also just want to touch on you, Kenneth, and what you've said about the role of community health workers, and the role that they can really play. Aside from the usual bits of planting trees and all that, what can we actually do in working with communities? And I'd like to just point out that as FAH, we've actually been filming some docuseries in different parts of the continent, finding out what community health workers are actually doing. So keep a close eye on that to see. There've been some interesting solutions that have come out of community health workers themselves. So that's something that you can look out for. I think an hour isn't enough to explore the intricacies, the complexities that go into climate health, climate change, and the intersection with health, and what we can do when it comes to solutions. This is definitely something we cannot cover in 1 hour. And even when we were thinking about the themes, there were so many sub themes to look into. This is an ongoing conversation, and we're hoping that we can keep these conversations going even after this webinar, and in whatever spaces you are in, that you are able to carry forward these conversations in whatever role that you are playing. But before I close this webinar, I would like to just give each panelist 1 minute for you to highlight what you think the key takeaway should be. If there is one point that you would like each of us participants to take home with us today, that you'd like us to ponder on, to reflect on, what would be the one key message you'd like us to take home? And since, John, you're unmuted, let's start with you in 1 minute, please.
Oh, sorry, here I just want to talk about the carbon credit, because we have a small organization that we have started doing carbon selling the improved cookstop to community members, and it came to an end because of funding, and we had reached around 1,000 households in where we are located. But we are using it's our own project as a community. We have a small CBO that does that carbon credit. But now for the successful of these strategies, for the all these examples of successful financing strategies, including the Green Climate Fund support, we need to have a very nice and good climate funding system that can help community health workers, that can be empowered to make sure that we mitigate this climate change and provide resiliency at all levels from the ground. So as we know, the ground is where we start from these things, and this is where we are. I think, thank you very much for that.
And your one key takeaway, your one key message that you'd like us to take home in 15, 20 seconds.
Sorry, can I come in?
Yes, Nathaniel, go ahead.
Yes, so thank you very much, Maya. I think my take-home message is innovative means of financing climate for health. It's very important because we have a lot of taxes in our country. I would like to go for government to prioritize these taxes to see whether these taxes can support an innovative financing mechanism for climate health in our country. So that's the message. And I also think what is key here is using the grassroots, using our community stakeholders, our community health workers to intensify what we refer to as sensitization, community sensitization. Thank you very much.
It's a great point, Nathaniel, especially since in Kenya right now, we've been having protests for the last 3 weeks because of this issue of taxation. So governments are definitely pressured on, how to raise revenues and what would be the right mechanisms. And, so innovative finance mechanisms are very important. Dorothy, how about you? What's the one message?
My one message is the community health worker slogan. If it's not happening in the community, it's not happening anywhere. Community health workers need to be empowered, not in terms of capacity building. They should be remunerated for the work that they usually do. They should be supervised by the supervisors. And I think intersectorial collaboration would do a good thing in terms of mitigating and adapting to the climate crisis that we're experiencing. Thank you.
Lovely. Thanks, Dorothy. How about for you, Joanna?
Saying that we need locally led, locally driven solutions, innovations. We need everybody to put their heads together and come up with ways to make these solutions scalable, and then come look for us because we are looking for those innovations to have the most impact and fund.
Awesome. Thank you all so much for joining this webinar. I won't take any more of your time. I'd like to thank every single person that joined this webinar. The audience has been incredible. You've been interactive. You've been sending your comments. You've been sending your questions. And I'd like to say that we've taken note of some of your comments. I think that this is very helpful for us to build on the kind of content that is needed, the kind of information that you need. And we'll definitely take note of these, and as we're looking forward to have more webinars or more sessions, like John spoke about, seminars and workshops and things like that, we'll definitely take all of those into consideration. I also would like to say that we'll have this webinar recording available, and yeah, we'll be sharing that with you in case you want to share with your colleagues, or if you want to go back and just take notes. So thank you all very, very, very much for joining us, and do have a lovely rest of your weekend. Thank you all, and goodbye.
Maya, you are muted.
Oh no, I was saying that I forgot to let you all know that we have a feedback poll here. Just for your feedback, if you can. It's just 2 short questions. How you found the webinar. I can see some excellence there, some good comments over there. We would love to also have your feedback on suggestions for improving our future webinars, so that we can get 100% excellent, votes. So yeah, that if you could just give us your feedback, that would be helpful too. Thank you, guys.
Thank you, Maya. Bye bye, everyone.
Hey, everyone.